Welcome to this session of the Living Your Best Life with Kidney Disease virtual forum. Thank you to Otsuka Canada and Paladin Labs for providing unrestricted financial support for this forum. Nous remercions Otsuka Canada et Laboratoire Paladin d'avoir apporté un soutien financier sans restriction à ce forum. The information presented in this virtual forum is current as of January 25th and 26th, 2022. The material shared in this presentation is not intended to be medical advice. We suggest people speak to their doctor about their own individual situation. This information is intended for a Canadian audience. Les informations présentées dans le forum virtuel sont à jour en date du 25 et 26 janvier 2022. Le matériel partagé dans cette présentation n'est pas destiné à être un avis médical. Nous suggérons aux gens de parler à leur médecin de leur situation personnelle. Cette information est destinée à un public canadien.
Hello everyone, my name is Lydia Lauder and I'm the National Director of Programs and Public Policy at the Kidney Foundation. Welcome to the Kidney Foundation's second Pan-Canadian Virtual Forum. Today, patients, care partners, healthcare professionals, and researchers from across Canada are sharing information with you on living your best life with kidney disease, coping, resilience, and well-being. I would like to introduce you to Elizabeth Miles, who is National Executive Director at the Kidney Foundation, and Sylvie Charbonneau, who is our Volunteer National President. Elizabeth has led the Kidney Foundation of Canada since 2015 as the National Executive Director based in Montreal, Quebec. Prior to joining the Kidney Foundation, she held senior positions at the World Federation of Haemophilia. Elizabeth serves on the Board of Directors of the Health Charities Coalition of Canada and the National Liaison Committee of Canadian Blood Services. Sylvie is retired from her work career and is now the President of the Kidney Foundation's National Board of Directors. She previously served as the President of the Quebec branch of the Kidney Foundation. On a personal level, Sylvie is herself a living kidney donor and is doing all she can to change the world one kidney at a time.
Bienvenue à tous et merci de vous joindre à nous. Je suis Sylvie Charbonneau. À la Fondation canadienne du Rein, notre vision est d'aider les gens à atteindre une excellente santé rénale et une qualité de vie optimale. Les forums auxquels vous allez participer ont été élaborés en partenariat avec des personnes atteintes de maladies rénales afin de fournir des informations et des sujets intéressants qui ne sont pas souvent abordés lors de ce type d'événement. Before we begin, we would like to recognize the Indigenous land that we are on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgement are a necessary step toward honoring the original occupants of a place. They also help Canadians to recognize the respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I encourage everyone to take a moment to reflect on that and acknowledge it. If you know the territory on which you're situated, I invite you to acknowledge it in the chat. I personally acknowledge that I am speaking to you from unceded Indigenous lands of the Abenaki Nation. Their name is derived from a word in their own language meaning Dawn Land people or people from the East. All Abenaki were part of the Eastern Algonquian cultures and were separated from other Algonquian in the west and north by a migration of Iroquoian-speaking cultures. We respect the continued connection with the past, present, and future in our ongoing relationship with Indigenous and other people across the country.
Hi, everyone. I'm Elizabeth Miles, and Sylvie and I are very excited to host our second National Patient Forum, which is virtually bringing together people with kidney disease from across the country and around the world. At last count, we have over 300 people registered for the forum. As Sylvie mentioned, the sessions have been developed by people impacted by kidney disease for people with impacted by kidney disease. Subjects we will be discussing during the forum include taking care of your mental wellness, living well on dialysis and after a transplant, financial support, tips and tools for a kidney diet, and wellness through movement.
There will be networking opportunity at the end of the program today and a simulation of a peer support meeting tomorrow to give everyone a chance to ask additional questions in a more informal setting. Et toutes les sessions seront traduites simultanément en français.
If you miss a session, recordings of each of those sessions will be available after the forum. We invite you all to take part in as many sessions as you would like, and we look forward to seeing you there.
And finally, the Kidney Foundation of Canada would like to thank our sponsor, Otsuka and Paladin Labs, for their generous support in the 2022 Patient Forum. I'll now pass the reins back to Lydia.
Thank you very much, Sylvie and Elizabeth, for your warm welcome to the virtual forum. It is my pleasure to introduce our moderator for our first session, Taking Care of Your Mental Wellness. Craig Lindsay is the Senior Manager of Programs and Public Policy at the Kidney Foundation's Ontario branch. He came to the Kidney Foundation first as a volunteer after receiving a kidney and pancreas transplant in 2014. He is passionate about embedding person-centered care across the healthcare spectrum. He enjoys baking, reading, and canoeing. Craig, over to you.
Thank you, Lydia, and good afternoon. It's my very real pleasure to introduce you to the first session today, as Lydia indicated, taking care of your mental wellness. It's also my pleasure to introduce to you now several panelists who are going to join us in a presentation and conversation today. Each of them bring their own either unique experience or professional words of wisdom on taking care of your mental wellness. Nadia Kayati. Nadia was diagnosed with type 1 diabetes, and she's lived with kidney failure for the last 2 years after a rapid decline in kidney function. She has experience with in-center hemodialysis and home peritoneal dialysis. She is a passionate advocate for equity, diversity, and for access for underrepresented communities. In addition to her busy career, she enjoys home projects, experimenting in the kitchen, and volunteering with the Kidney Foundation as a peer support group facilitator. Lisa Babin. Lisa came to the Kidney Foundation as a person living with kidney disease in 2021. For many years, she suffered with kidney complications, constant kidney stones, and infections that nobody could explain. In January of 2021, it was realized it was kidney disease. Lisa also copes with other chronic conditions. Mental health complications have been with her since she was young, and she has experienced varying degrees of complications over many years. Living her best life with kidney disease and a healthy mind is what she tries to do each day. Loretta Lee. Loretta's journey started about 30 years ago with a diagnosis of chronic kidney disease when she was 26 years old, and she was a new mom to her only daughter. She had been healthy, or so she thought, until suddenly she was not. Working as a registered nurse full-time, caring for her child, her family, and her home, she also stayed very active in her community. Being a nurse, she thought, oh, I have this. She has suffered many losses, losing her independence, becoming a patient within a healthcare system, and within her own expectations of herself. She has felt very isolated, lonely, overwhelmed, anxious, and has struggled with staying positive. But she says being a chronic disease patient of this magnitude forces you to make life and death decisions as a matter of course, which is not something you're really prepared for. Stefan Chan. Stefan is a registered nurse who has worked in an acute mental health unit in Hamilton, Ontario for the past 9 years. The acute mental health unit Stefan works in is unique in that it manages patients with complex psychiatric illnesses in addition to medical concerns. In the past, he has worked in psychiatric emergency services, responding to patients in acute crisis. In addition to these experiences, he currently works at the renal department at Trillium Health Partners as a hemodialysis nurse. His experience as a psychiatric practitioner has taught him skills that are transferable to working with renal patients and their mental health concerns, such as anxiety, depression, and ineffective coping mechanisms. Andre Gomez is also a registered nurse serving hemodialysis patients at Trillium Health Partners with a strong background in emergency and critical care medicine. He is a huge patient advocate. He's energetic, outgoing, and passionate about supporting those in need. Wade Neal received a live donor kidney in a paired exchange in 2020 after only 29 months of dialysis. His friend had donated his kidney on his behalf, and a match had been found. After the transplant, he immediately began to feel better. Over the next year, a number of issues presented themselves, both physically and mentally. The feeling of gratitude to his family, friends, healthcare workers, and most of all to his donor. That said, he also experienced guilt, fear, and other uncertainties that he found hard to deal with alone. When he was on dialysis, he had access to all kinds of support. But with a new kidney, the support that carried him through all of his sickness and hospitalizations was not as present. He says he was and is one of the lucky ones. He has been supported through his entire journey from so many different places and people. And the one thing he learned from his experience is that the support he gets is one of the keys to a successful transition from dialysis patient to transplant recipient and beyond. Now, he finds himself wanting to give back and offer any kind of support to other patients who are experiencing a similar path as he did. Brenda Brown is an 8-year post-transplant kidney transplant recipient. She received her kidney via the paired exchange program. To help with her recovery, both physical and mental, Brenda rediscovered sport. She discovered the Canadian Transplant Games and competition and became the project manager for the 2018 Games, as well as winning a gold medal in tennis. Brenda focuses on enriching her own lifestyle with yoga and meditation, and she became a certified yoga instructor in 2019. For our first segment, we have two presenters. Kara Shik-Makarov is a researcher, and the goal of Kara's program of research is to promote use of quality of life assessment, enhance person-centered care, and to improve services for people living with kidney failure. Dr. Megan Elliott is a nephrologist and assistant professor at the University of Calgary. She completed her clinical nephrology training at the University of Calgary and earned a Master of Science at the University of Toronto. Her focus of research aims to support patient, family, and provider engagement in person-centered kidney care and research. With that, Kara, Megan, I invite you to share your screen and guide us through your first thoughts.
Thank you so much, Craig. I'm going to share my screen. Maybe, Craig, you can let me know if you can see it.
Sorry, Kara, I can indeed.
Okay, awesome. Okay, now I can't see it. So let me just, sorry, I'm just going to stop sharing for 1 second. Take 2. And there. Wait, can you see full screen now, Craig?
Yep, that seems
okay.
Perfect,
Awesome.
Kara.
Okay,
Wonderful.
now we're cooking. Okay, awesome. Thanks for all the invites, and thanks everyone to being here for this amazing first session to kick off this forum. We're just really pleased that you're able to join, and we welcome your engagement, as we heard at the very introduction, in the question and answer box. So yes, our first session is taking care of your mental wellness, and Megan and I are going to start, and then we're going to engage in a discussion with the panel, but also with each of you. So we're using these terms today, mental wellness, which is kind of like a joining or a conjoining of two more well-known terms. So I thought maybe we'd just start by pausing and saying, what do we mean by those words? Mental health and wellness. So mental health is a state of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety and disabling symptoms, and a capacity to establish constructive relationships and cope with the ordinary demands and the stresses of life. And wellness, it's a dynamic state, physical, mental, and social well-being. But the wellness concept is a notion that individual healthcare and healthcare programs should actively involve the promotion of good health and physical health, rather than being concerned merely with prevention and treatment of illness and disease. And in this forum today, we want to explore, how do we pursue wellness when we're living with a challenging illness like chronic kidney disease, and for many people at the same time encountering mental health concerns. So also, why are we looking at this? Why is it important? Well, as we just read in some of those definitions, mental health includes coping with stresses of life. And the panel participants that are here today are going to share about how significant really this has been for them. And perhaps in the Q&A, you want to add in about the things that you're encountering, because this is meant for all of us to have a discussion today. But certainly the reports of depressive or anxiety symptoms are the most common among those who are living with chronic kidney disease. So before COVID pandemic was declared internationally, 4 out of 10 people receiving dialysis treatment reported depressive symptoms. And then the range here is between 2 to 5 out of 10 people receiving dialysis treatment reported anxiety symptoms. And in the research that we've done in Alberta specifically, we asked people who were receiving dialysis about how they were doing, particularly with depression and anxiety. And their responses were the same as these international reports here. But of course, we're all living in a different world now, aren't we, during COVID? And Canadians' reports of mental health have doubled since the pandemic was declared. So this is not good for people who are receiving particularly dialysis. But I would also say for people that, as was already shared actually in the introductions, people who have the full gamut of experience with kidney disease and failure and treatment can be really devastating. And when it's left untreated, it certainly is linked to poorer quality of life, increased hospitalizations, longer hospitalizations, and even death. And one of the big challenges is that mental health care for Canadians receiving dialysis treatment is rarely addressed or treated in kidney care, which begs the question, why? So in some of the research that I've been involved with, particularly on quality of life for people receiving home dialysis, we heard from patients and clinicians about mental health, and these comments were unsolicited. So we didn't ask people about this. They told us because it was important to them. And eventually we started paying attention. So here's what a few people in our study told us. There, a patient said, "I've met many, many medical staff that are scared of depression." Healthcare provider said, "Depression. Most nephrologists would just as soon not hear about things that don't really fall into their scope of practice." Another healthcare provider said, "We need some resources or some tools or even a bit more education around mental health." And another patient said, "Coping with kidney disease. is a mental milestone. It's self-consuming. Dealing with anxiety and depression is always there. It's always at the forefront. It feels like there's nothing I can do about it or anything there to help me. But what we want to say today is that there is help and there is a community of support. And this is why we're here today, isn't it? We're going in this forum. We want to raise the issue together. We want to listen to each other. We want to be supportive to each other. And at the end of this session, we're going to share resources. Our research that was in home dialysis was confirmed in another study called Empathy through CANSOLVE, CKD, in Alberta Kidney Care North. So we found here that people receiving dialysis treatment, but also the nurses, agreed that there were a lot of tensions about mental health management in dialysis in particular. And they also told us that systemically there was a lack of mental health resources for people experiencing mental health concerns. And if that wasn't enough, at the same time that we were doing this work in these research projects, there was a group of people with lived experience in kidney disease. It was part of a kidney patient-led study on mental wellness through the PACER program, which is Patient and Community Engagement Research. And they highlighted the gap in mental health care for people living with kidney disease. And their report, I have a screenshot here, it's called Unplugging While Plugged In, a peer-to-peer exploration of the impacts of dialysis on the mental wellness of patients with chronic kidney disease. And I want to read this quote from their report. The most glaring gap in care is the lack of psychosocial support available to patients and to those supporting them. So we wanted to ask people receiving dialysis also, because, we were hearing these reports from, as I said, very unsolicited ways that this was coming up. So we thought we should ask people. So in our community advisory committee, people with lived experience of kidney disease, they really recommended that when we asked people receiving dialysis, that we not use the term mental health. Because so much stigma is attached to it. So they advised that we use this phrase, coping with and adjusting to, and to dialysis. Loretta Lee is on this call. Loretta is co-chair of this community advisory, and I just want to thank her for her leadership on this work. So we took their advice. We did just that. We asked about how are you coping with and adjusting to dialysis. We sent a survey to all Albertans receiving dialysis. And this is the image of results that we sent to patients. But the takeaway here is that those who reported the greatest mental health concerns were absolutely willing to engage in support for their mental health. And this is often counter to what we think people are going to say. We often think that those with the greatest mental health concerns don't want to engage in support. But that's not what we found, which is really wonderful news. So before I turn it over to Megan, I'm just going to say, comment on, why is all of this important to me? So my first job as a nurse, when I was a brand new grad nurse, was actually in mental health in a hospital. And that's where I worked. And then fast forward a number of years when I started doing research to support quality of life for people living with kidney disease. And when we started to hear in our research many years ago that both patients and clinicians saw this mental health gap in care, to be really honest, I couldn't really understand why. Because as nurses, when we're trained in mental health in our undergraduate degrees, we all go through probably about a year of theory work and placements. And so we do receive training. But I think when we start working in kidney care, often it becomes very technical. And we start focusing on a body part, which is the kidney. And personally, why this is important to me is that when we talk about quality of life, we're talking about what matters most to the person who's living it, who's living the life, what matters most to you. And certainly the body and the mind are intricately connected. They shape how you experience kidney disease. And I would even say they shape the entirety of your life. And so because of that, they shape your care, they shape your symptoms, they shape all the people and the relationships that are around you in life. So these parts are very interconnected and they make a whole and they create the totality of your quality of life. And what I would say is to anybody who's living with kidney disease that you are more than just your kidneys, and our kidney care needs to reflect this. So I'm just going to mute myself now. And Megan, let me know when you want me to go to next slides, okay?
Sounds good. Thank you, Kara, and thanks, Craig and the Kidney Foundation for this wonderful opportunity to share some of my perspectives. I'm going to spin off from what Kara had just finished talking about why it's important to her. And so I thought I would share a bit about my experiences as a kidney doctor and how this issue of mental wellness has come up with me in encounters with patients. So as I mentioned, I'm a nephrologist, a kidney doctor. I do not claim to be an expert in the area of mental health and wellness. And in fact, I don't think anyone is an expert in mental wellness other than the person who's actually experiencing it themselves. That being said, there are a number of people with expertise and skill sets who are available to help, including one of our panelist members. And so this issue of mental wellness, as someone who's gone through kidney training, medical training not too long ago, I have to admit that I didn't really appreciate the struggles that people went through. A lot of our training is so clinically focused on learning about disease and what causes disease, how to treat disease, without really considering the person as a whole and all the other contributors that can exist when you're dealing with a patient or a patient as a person. So since I've been in practice now the last few years, I've developed these relationships with clinicians and the kidney care teams along with the patients. And I've started to think more about these issues. In addition to my clinical work, I do some research as well, like Kara. And Kara, if you can just advance, I'm just gonna show a quote that came from a study I did a few years ago. And this is talking to a person who at the time had advanced kidney disease. Their kidneys were at about 20%, I believe, or 15%. And this quote has stood out to me over the years, and I think about it not infrequently. So prior to joining this group, I really had not met any CKD person. It's quite an isolated personal space, you know? You wait in the hall to see your doctor, you go in and you meet your doctor, and then you leave the clinic and you're back to your home setting again. Rarely do you meet or interact with another CKD patient. To me, this has really just stuck with me, I think, because I did not appreciate how isolating the experience of kidney disease actually is. And Kara, can you advance? And which is mind-boggling considering that 1 in 10 people in Canada have kidney disease. It's such a common issue. And the fact is, in the vast majority of people who have kidney disease, it's silent. No one would know just by looking at you that you have kidney disease, and only until it's in its very late advanced stages do people actually have symptoms or manifestations. We know that kidney disease can contribute to other health problems, things like heart disease and diabetes. It can have poor health outcomes, things like hospital visits, risk of mortality or dying, and it contributes to high costs to the healthcare system. But on the flip side, it is also associated with a number of the things that Kara has spoken to about quality of life, reduced quality of life, depressive and anxiety symptoms, as well as challenges with coping and self-managing. So managing your own condition and coping day to day with the challenges. I wanted to touch on this issue of complexity in kidney care. Did you know that the average person with kidney disease has 4 comorbidities or coexisting health issues, most commonly things like high blood pressure, diabetes, and heart disease. People with advanced kidney disease or on dialysis take an average of 18 to 20 pills a day. And actually 1/4 of people on dialysis take more than 25 pills a day. And the symptom burden is unbelievable. Up to 3/4 of people with kidney disease experience fatigue. Other common symptoms are things like pain, itchiness, reduced appetite. So again, with kidney disease being a largely silent condition, I think we underappreciate a number of these issues that come up and really struggle to manage the complexities associated with kidney disease and shifting our focus from looking at the kidneys itself to looking at the bigger picture issues. And next. I wanted to show this case, and this speaks again to the notion of complexity with kidney disease. So person A and person B, the person A on the left, they're identical in every sense of the history I've presented to you here. So a 78-year-old man with kidney disease, kidney function is 20%, has a history of heart disease, diabetes, and early dementia. However, the patient on the left is living independently with their partner. They're living nearby children who are well and active in his care. They can help him with his activities of living. So things like bringing meals over, helping take him to appointments, as well as he's financially secure. So he's retired from a well-paying job. He has pension and benefits. If we contrast that to the quote unquote identical patient on the right, you can see that they're actually, in fact, quite different. The person on the right lives alone, has no nearby family, is not as financially secure, relies on social assistance and alternative funding sources, experiences food insecurity, not only in purchasing foods, but also adhering to or following the recommended kidney diet. Also has difficulties with transportation, is unable to drive, has no one to drive him to appointments. So the point of highlighting this is that someone who looks the same as another person on paper, if you dig a little bit deeper below the surface, you realize that they're actually quite different and they have very different needs beyond what we would expect if we looked at them just from a kidney-focused perspective. So this all reflects shifting from a disease-focused approach to care to one that's focused on the person as a whole. So as I alluded to on the previous slide, complexity can refer to a number of things. And when we speak to complexity in kidney disease, looking at kidney disease itself, these are just some of the big buckets that we can be focused on, or when we include a disease-focused approach to care. So things like symptoms, pain, itching, fatigue, very common. The decisions that people face with advanced kidney disease. So if and when one chooses to start dialysis or go forward with a transplant, if, when, and how often someone might choose to take their medications. Uncertainty plays a big role in caring for complexities related to kidney disease. Uncertainty about your risk or prognosis, what the future might hold. What is the risk of kidney failure? What is the risk of dying? As Craig introduced in the bio for one of the patient panelists, facing these life and death decisions and all the uncertainties that go along with that. And then it's not just the kidney disease that someone has to look after, but it's managing all the other health issues that go hand in hand often. Things like high blood pressure or heart disease, for example. Next. And so again, if we take the step back and look at the person as a whole, we realize it's more than the decisions, the black and white, yes or no decisions that they face, managing the symptoms or the blood pressure or the diabetes. It's also focusing on all of the other factors in someone's life and environment and social circles that can contribute to health and well-being, including mental wellness. Things like someone's education level, health literacy, or their ability to understand and make decisions that are informed, access to healthcare. What kind of environment or housing resident situation are they living in? What are their community supports looking like, or family or friend supports, and financial and economic stability? So I add this again to show the complexity of kidney disease, that it is more than just the disease, and that the person experiencing kidney disease can have a number of other issues below the surface that aren't apparent if we don't ask about it. So to me, when I was reflecting on this, it really highlights to me this idea that you need a team. None of these issues can be addressed in isolation, and no one single person can tackle everything, including the patient. A person living with kidney disease cannot tackle all these issues on their own without help. So focusing on collaborations, identifying the people who can help in these different domains and how they can collaborate and communicate with one another to participate in a patient care. And Kara, can you just advance? And that's why in the majority of kidney programs, spanning from pre-dialysis or non-dialysis CKD clinics to dialysis clinics and programs to transplant programs, in most centers, you will see a big comprehensive team that has a number of people who do have expertise and skills and links with these different areas. So nursing staff, nephrologist, your kidney doctor, your social worker, the dietitian, all these folks who you've been seeing for many years now. And I think we also cannot forget or neglect the people that are outside of that kidney care team, outside of the immediate kidney care team. People like family doctor. There have been studies that show that the majority of people, even on dialysis and with transplantation, still see their family doctor at least once or twice a year. And then, of course, not neglecting the mental health expertise that is available and out there. So psychologists or psychiatry teams. You can advance, Kara. And lastly, recognizing that at the center of these teams is the patient or the person who's living with kidney disease, not forgetting that there is a community of peer supporters or individuals who also have lived experience with kidney disease, who are available and willing and keen on sharing their experiences with others, or allowing or enabling someone else to share their experiences, their frustrations, ask questions, seek guidance from. So I don't want to spend too much time talking about peer support, because I know that there's a later session in the forum dedicated to this. Just to say that peers or other people living with kidney disease are considered part of the broader team of people and supports who are available to help if you need it. And I think I'll end there, Kara.
Thanks, Megan. So I'm just going to wrap up, follow up on Megan with just a couple of last slides. What helps? So when we look at the research that specifically has looked at mental health concerns for people living with chronic kidney disease, there's two kind of buckets: the psychosocial interventions and medications. So under psychosocial interventions, the one that has the highest level of evidence is cognitive behavioral therapy. So what is that? We more likely know it as CBT. So it's a psychosocial support that helps improve unhelpful thoughts and behaviors, and it's through the development of coping strategies, particularly when they're targeted at a specific problem. And then after that, the other ones are counseling, exercise, and relaxation techniques. And then when we look at pharmaceutical or medications, certainly there is some literature that says it can be helpful, but to be honest, there isn't a lot, and it's primarily focused in the areas of depression and anxiety. But as Megan alluded to earlier, that a lot of people who are receiving particularly those receiving dialysis, but it's true for people with chronic kidney disease across the spectrum. There's a huge amount of medications that they're already taking, and some people can be quite adverse to adding more, even if it relates to depression and anxiety. So that's a bit of a complicating factor. And it's worth having a discussion with your healthcare providers if this has come up and they believe that this may be of help to you. As I alluded to earlier, when we were asking people about how are you coping with and adjusting to dialysis, the community advisory said, you can't really ask people that and not provide any supports. So we put together on our website here, healthyqol.com, kidney resources that are available. And they're a part of the larger list that is going to be shared at the end of this session of multiple resources. And I just want to end actually by thanking the Kidney Foundation of Canada, because they have also funded a piece of our research called Tailoring a Pathway for Mental Health Care for Albertans on Dialysis. And in the next 2 years, we're going to be creating a pathway with input from many stakeholders, patients, clinicians, administrators, primary care, GPs, mental health care providers, to figure out how do we do this well and how do we provide supports both to patients and to clinicians alike, because that's what we heard is we're not really sure what those next steps are. So just to end this session, to say thank you for your attention, I'm going to pass it now back to Craig and to the panel for further discussion.
Thank you, Kara, and thank you, Megan. I don't know if you felt it. I sensed a coast-to-coast collective sigh of relief that it's okay to talk about this managing your mental wellness. I always feel a little less alone, a little less isolated, a little more hopeful when I'm in a space with other people living a similar journey. What a great start to the discussion. You may have seen too that some of the panelists, the people with lived experience, almost seem to be straining at the bit, that they wanted to pipe in and say, that's so true, that's so true. I remember feeling that way as well. This is, you're preaching to the choir here, I think. So many questions came up. And as I came to know the panelists, I was really looking forward to an opportunity to learn from them. I'm going to pose some questions, and to the people watching, I'm going to try to make as good use of the time as possible, but this isn't the end of the conversation. Afterwards, we're going to help you find lots of ways to stay connected with amazing volunteers, peer supporters, people just like you sitting on the panel. Lisa, my friend Lisa Babin, I wanted you to start by telling me about the notion of stigma. It came up in the presentation. I wonder, can you talk about what stigma means to you and how you struggle to overcome it?
Thanks, Craig. You know, stigma is something that has been with mental health since I can remember. Like, I've struggled since I was like probably 8. So you're talking over 40 years I've struggled with mental health, going on 50. And, you know, how I deal with it now is completely different than how I dealt with it when I was younger. I've been approached when I go in to see many different specialists. Oh, it's your mental health. Oh, it's your mental health. It's nothing else but your mental health. I have learned now when I go into a doctor's appointment to be prepared. So that way I go in a calm presence and my emotions don't go with me. I don't get overwhelmed at an appointment because I go in prepared with questions for the doctor so I can hear what the doctor's saying. And I then get to ask my questions. So I'd have to say my best way to deal with stigma is I go into an appointment prepared so I don't go in with my emotions, because if I go in with my emotions, I'm shut right down and told your mental health. And that's about all.
That's a lot. Thanks for that, Lisa. Nadia, I'm curious, as I came to know you, and you're a peer support facilitator, you help other people, but the simple idea of asking for help and how you expect to get it, who you think you can trust to start that conversation with. Can you speak very briefly about who you are, where you come from, your age, your gender, your culture? How might that complicate how you ask for help?
Absolutely. Thanks very much, Craig. I think it's really important to understand the effect that your personal background has on your experience, on experiencing of the world, but also your ability to ask for help and support. I'll share a quick anecdote because I think it helps demonstrate the point well. My dad immigrated to Canada from a very oppressive dictatorship in the early 1980s. And that really colored the experience of my family. And when we're talking about mental wellness in an immigrant family, you have to understand that we have people that have come from countries where their basic needs were not met. They were extremely oppressed, lacked rights of all kinds. And when we find ourselves in Canada, we are just abundantly grateful and, you know, almost ashamed to admit that it's something internal within us, our own thoughts, our own anxieties, our own fears, our own angers that are causing us a problem when we've transitioned into this new life where everything should probably be so great. So I think that has really, the intercultural perspective really colors your ability to ask for help and support, and also affects how you interact with people around you. For example, you know, depending on the background that you have, the culture that you come from, self-advocacy in the face of doctors and other health professionals could be an issue. I know in the cultures that my family comes from, it's a challenge. It's a challenge to stand up to authority and to ask questions and to really be your own biggest advocate because of those perspectives.
Great insight, Nadia. Thank you. Stefan, I'm going to pose a question to you, and Andre, you're next. So start thinking. How common is it that people in your care, as part of your routine care, that people might say, I'm struggling, I don't feel myself. Physically, I'm good, but inside something's going on. Does that come up often? And how well equipped do you feel to respond to that?
I know in my practice as a dialysis nurse, that question doesn't nearly come up as often as I think it should. A lot of patients have a lot of hesitancy in order to bring up those sorts of topics. Like it was said earlier in the presentation, there is a lot of stigma associated with mental health, but I know, you know, being a nurse and the nurses, and part of our training is how to kind of direct those questions or try to find the resources appropriate for the patient. So it really comes down to open communication and being able to talk to your healthcare providers about, you know, all of your concerns, because it is about the total patient, not just about your kidneys or about dialysis when you're coming in for treatments and whatnot.
Just quickly, Stefan, as a follow-up, Karen Megan mentioned it, that sometimes people are afraid. I don't know if there's a worry that it's going to impact their care, that if they acknowledge they're struggling. Is there anything you do to start that dialogue? Do you have like some questions you ask as a matter of course when you meet your patients in their regular care?
Just you know, simple small conversation. You know, how are you doing? How's your weekend? Bringing up you know, little things. If I know the patient is wearing a Jays cap, then I'll start talking about sports and kind of seeing how they are and kind of assessing them as we're talking, you know, what their affect is like, what their speech patterns. If they are looking quite upset, I might, you know, kind of dig into it a little bit more and discuss with them kind of what's going on.
That's great. Andre, I'm curious. I mean, the work of a healthcare practitioner in what you do is busy. You've got a lot to cover in your patient interactions. How often do you have the time and space to check in with people and see how they're doing emotionally, psychologically?
Realistically, so I come from a critical care background and emergency background. And so I spent 8 years working in the emergency department, and I will be honest, I did not have the time to address there's very many issues that often came up regarding mental health or emotions. I have been working with dialysis patients for about 2 years now. And I can assure you that as dialysis nurses, I think we have more time to sort of see and create relationships with the patients, which allow us to like sort of understand and see when patients are declining in their mental health. I think it's also the perception of, as a healthcare provider, understanding what the patient is going through, their journey and their loss, right? I've had many times I've been asked to pretty much start a new dialysis patient. Oh, this is their first treatment, and they're quite apprehensive. They're nervous, but my job is there to reassure them. But I've also seen the progression as they start their first year, second year. I can tell that perhaps they're more frustrated. They're starting to show a little bit of anger at the system. Perhaps their appointment is a little bit delayed and all of that. But I will tell my patients often as Estefan was saying, through little conversations, if they feel that they're struggling with mental health, please let us know, because we can always make a note in our charts, right? There is a point where we share experiences with patients, or they share things that are going on in their life, but we don't necessarily document what's going on. So I will let patients know if it's something that's really bothering you. Let me know. I can put in a note, and I'm pretty sure down the line we're going to address those issues as well. So that's how I approach my practice, and I'll say that as dialysis nurses, we do have a bit more time to deal with mental health issues.
Thanks, Andre. Very, very good insights. Wade, as I've come to know you and your story, and I acknowledge your courage in sharing it, a long, complicated story of living with kidney disease. And I was particularly taken by the point you made that when you were on dialysis, you got very robust care. You were well supported. You had a full team. But I took note too that transition to transplant, and sometimes people think that the transplant is the answer to all your problems. It solves everything, and there's no challenges moving forward. I have a feeling you have some insights to offer on that. And you can speak specifically about questions, challenges you had, but I would be very curious to hear where you eventually found support.
Well, yeah. I did in-center hemodialysis with 6 chairs. I knew my nurses, and unfortunately they knew me as well. I couldn't walk through the door and hide anything. I mean, one of the team leads, Tanya, man, she had my number. If I was bothered by anything, she would nail it right away. And she was, like you say, Andre, where you go up and you spend 2 minutes with them just to say, and she would get a fantastic sense about that. I struggled with the same things everybody else did. I struggled with diet. I struggled with medications and the numerous ones and tracking and things. And I was surrounded by support. And yeah, there is and I'm going to call it a misconception, that once that kidney goes into you, you're good to go. And it's not the case. I was lucky that I have stalker qualities. When I sat close to the nurse's station during my treatments, because I had nothing else to do, I would listen. And one of the fantastic events when I was put very close to the nurse's station, and this particular moment I thought meant nothing because I was only horsing around. The team lead, Tanya, was on the phone and she gave her email address out. And during that time, I had my phone right beside me. And I emailed her a picture that looked something like this. I kept that email, and I thank God I did, because I keep everything because I'm like that. But after my transplant, I was not experiencing the correct emotions. I had waited, as you said, 29 months on dialysis. waiting for this goal line, waiting for this goal line, waiting for this goal line. And I had real anticipations and expectations of how I was going to be. And it wasn't anything like that. And I kind of fell apart, and I would write, oh, I feel so bad for the nursing staff at Headwaters, but I would write letters and about everything that I was feeling and that I was experiencing. And they coached me and guided me. And then I was recommended to go see somebody professional. They're happy to listen, happy to talk, but they couldn't point. I wasn't experiencing the correct emotions. I was distraught that I was leaving dialysis. And of course, you say that to anyone who's ever been through anything like this, they're like, how can that be? I stopped feeling candidation 6 months in. I mean, there wasn't a pain issue. I missed that interaction. Now, COVID hit, so all I had was dialysis for sociability, because when COVID first came out, they basically told you, if you caught it that's basically the end of you. I mean, they led you to believe that, or maybe that was just me, I don't know. But in moving forward, and I wasn't experiencing proper things, and I would cry and cry and cry all the time because I missed them, and that I didn't have that interaction, or I didn't have that, what I thought was support. And then I got pushed off to, well, not pushed off, that's not wrong, because I'm still actually in touch with the nurses now because I have their email address. And I look in the window sometimes, and I drop coffees off, and I bake, and I drop stuff off. And Nurses Week, I try to get on the Monday and I feed them for the entire week. But that was my expression, and they accepted that. But yeah, the expectation of everything's going to be okay is great. But I'm 14 months past now, and I don't know if I'm there yet. Like complete recovery, I'm not sure.
That's okay. I know there's lots of people here who have been living, I think there's actually a session living with transplant. You get the chance to meet someone living with a transplant for 40 years, I believe, who still is blunt and honest and says, I don't know if I've got this nailed down yet. So it's okay. And kudos to you for being open about this. I lived long enough to hear someone say they missed dialysis. I've ticked that box off. But I acknowledge too that when you leave that care team, you feel very isolated. Loretta, your story really had an impact on me, because when you talk about how hard you have to work to make it look like you're okay, and all the things you're juggling, your life, your role as a mother, your professional responsibilities, it's hard work to appear normal. Is there any space in there to say, I'm not doing okay? Tell me about it.
Good question. Thanks, Greg. For me, it wasn't a question. It was like, part of that was my upbringing, very, very stoic family. So you don't show your weaknesses. So through my 30 years of dealing with, CKD and now end stage and transplantation and all that, when I reflect back on it, I just can't help but think how overwhelming and defeated I would feel at times. Like, for example, when I had to switch to in-center hemo for a time, I just, I talked myself up, said, yeah, this is going to be fine. I'm in good hands. But deep down inside me, I never wanted to do hemo. It was like the last thing I ever wanted to do to stay alive. And here I was sitting in this chair, being hooked up to this machine, which I dreaded. I think I made it to the third appointment. And that's when I just totally blew it. I just melted. I was crying, and you're so isolated in that chair. But thank God there was a nurse on that saw my distress and came over. And all she had to do was lower herself to basically my eye level. She put her hand on my arm and just told me everything was going to be okay. And she didn't really say much more, but that touch and that getting down to eye level was just what I needed. I didn't stop crying, but it's what I needed. And the other thing I would say is that the pressure, I guess, I put on myself to keep up. Like when I was nursing, I would, I'd go to do my hemo and I wasn't out of there till 10:30, 11 o'clock at night. And then I'd have to be up like at 6 in the morning to go work in 3 different clinics, driving halfway across the city sometimes in busy, busy, busy clinics. You know what healthcare is like. And by the time I'd get home, I'd be on the couch. I didn't want to eat. I didn't want to do anything. I just had to rest. So it was that constant pressure of, you can do this, you can do this. You can show them that you can do this. And it was just forever pushing yourself to exercise, to try and eat, to, just manage life and try to be there for your husband, being there for your kids, being there for the community, being there for your profession. It's just mind blowing when I think back and think what I was doing while I had a CV in my neck, and it was crazy. Staying positive is huge, because I feel dealing with any chronic disease, certainly with end-stage renal disease, you have to have a positive attitude for the majority of the time. And for me, that came from my husband, my family, my faith, and also just to continue my education. Like, I've retired from nursing, but I really need to know what is going on. So for me, I actually went to the U of A bookstore and bought the same book that doctors would read. So I need to know the nitty gritty. That's one of my coping and staying positive. Another good thing I would say is that I joined CANSOLVE, CKD, and one of the first things I did was take their storytelling course. And through that process of having to rewrite my journey from an emotional, from a humanistic point of view, that helped me to really see what I was actually going through outside of the medical, outside of the nursing aspect. So that was very therapeutic for me. That's it, I think. I could talk forever, but that's it.
And I could listen to you all day too. I appreciate what you said about developing your coping mechanisms and finding your supports where you found them, your faith, your family, becoming educated and involved in your care. Everyone has different strategies for that. And I hope people in attendance are starting to think about where they want to build their support systems. Nadia, as I've come to know you, and I'm glad that Sadia introduced us, you speak often about the power of helping others and how it feels to support others, whether you look across the dialysis clinic and see someone who you think is struggling and how you feel comfortable, sometimes not, reaching out to support. Can you tell me about your thoughts around patients, supporting patients?
Absolutely. I would have to say that one of the most powerful things that I experienced that has helped me to change my perspective on my own situation and the anxiety and the fears that I was feeling was the support groups that I found through the Kidney Foundation. And I'm not just saying that because I find myself here today, but the feeling of isolation that I'm hearing so many people raise was the most impactful element for me. When I was diagnosed, I was 29 a couple of years ago, and at the clinic that I was a patient at the time, the nurses there told me that they had no patients under 60 years old, and that all their patients were retired or had to leave their jobs. And it was just this doom and gloom sort of picture on what the dialysis journey could be like for a person that was younger and still in the workforce. So after many appointments where I sort of tried to look around those waiting rooms and see if there was someone that I could relate to or could relate to my situation, I finally took the step to email the coordinator, Sadia, who's on this call, about getting in touch with other people that are in situations like mine. And that truly was the best thing I have done along this journey. It took me a while. I started by looking up the programs on the website. The next time I visited the website, I bookmarked it. So it took a little bit of a ramp up, but I finally got there. And the type of support that I found through the peer support groups and one-to-one support has been incredible. It's really that sense of community that has changed absolutely everything for me. And seeing the great successes that people living on dialysis or with reduced kidney function or after transplant have been so encouraging and so reassuring to me. So I would say from that experience, I have taken away the power of building a bridge to somebody else. So now I think I may be that annoying person in the waiting room that approaches people across the hall or the aisle and says, "Hi, how are you doing? How are you feeling? How are you managing with everything? What are you doing to cope?" And I think the experience that I have and how that changed the possibilities for me from looking at dialysis as, just pure survival. Your life has now shifted into the mode of, you're not thriving, you're not achieving things, you're just in pure survival mode, to understanding that dialysis is not the end, that kidney disease is not a death sentence, and that you can still enjoy all the elements of your life that you did previously while dealing with chronic kidney disease in some format. So I think we all probably do a really good job of putting on a brave face, behaving stoically. And again, like someone referenced, we go from waiting room to waiting room, and, there's, in and out. And when we leave the confines of the hospital, we don't necessarily look sick. People wouldn't necessarily know that there's something wrong with us. So I've really taken the proactive step of approaching people wherever possible in the hospitals and in clinics where I know people probably have kidney disease at some level, to just reach out, just extend a hand to build a figurative bridge to see if maybe they do need some assistance or are looking for someone to talk to or are looking for a resource to help them. And I found that that my experiences have tremendously influenced that with the Kidney Foundation.
I love your shameless shout out to the Kidney Foundation and peer support. I would love to have seen a friendly face like you in the waiting rooms. I'm sure most people would. That's wonderful, but it takes courage to step up and say, you're not alone in this, and acknowledging I struggle too. That's okay. Got time for a few more questions, and I've been following along, and the team has, with the questions in the Q&A panel. I just want to quickly say that the Q&A and the comments, they're really not meant to raise issues with your care team, to name healthcare facilities, to call out physicians. This isn't the forum for that. There is a place to do that. There are ways the Kidney Foundation can support it. You don't have to manage these conversations alone, but this isn't the space for it. And I'm going to ask a few more questions to the panelists, and then I'm going to scope through the Q&A. Some people are putting some amazing questions in there. We're going to take this right up to the last minute and squeeze every drop of patient experience out of this, I promise. Lisa, I've been thinking about you, and you're so admirably open about managing mental health and kidney disease. And sometimes kidney disease leads to challenges with mental wellness, and sometimes people have long-standing challenges with mental health. And often it's hard to make a care team understand what the difference is. Not all your symptoms can be, and I hope I'm not paraphrasing this wrong, not all your symptoms can be traced back to a pre-existing mental health diagnosis. Does that make sense? I don't want to simplify this too much, but I would love to hear your thoughts. You spoke briefly about coming prepared with specific questions. How do you coach your care team to address your physical symptoms, your mental wellness symptoms in a way that supports you? Love to hear your thoughts.
Thanks, Craig. Absolutely. When I stop and think about it, there's like 7 different people part of my care team now. And I never thought I would reach the day where I have a list of 7 different people part of my care team. But for me, I think it goes back to what the doctor was talking about. And that is that you are a whole person, you're a whole body, and you come as a package. And that when it comes to treating you, you are a package, and that package needs to make sure that it is looking after the emotional part of you as well as everything else. So for me, having support around me in terms of a support group that I can talk to is important, because I understand that going into each and every doctor, they have their own point of view. So it's up to me as a person to bring everything together and to represent me as a human being and a whole person, not just Lisa with her kidneys, Lisa with this, but the vision that you're one whole person. And I've had to let go of a lot of expectations on me over the last year. And that was really important, was that I don't expect too much out of myself, and to let go of some of those expectations that I have, that the house be constantly spotless or anything else, because it's more important that I spend the time looking after me and making sure that inside I'm okay with everything, rather than making sure that the house is spotless when my daughter comes over with my granddaughter. So I hope I answered that for you, Craig.
You answered it and more. It brings to mind the thought, always be kind to yourself, first and foremost. Don't hold yourself up to unrealistic expectations. You're dealing with a lot. If the house is a little messy when the family comes over, it's no reflection on who you are as a person. I'm curious, Kara or Megan, it was sort of gently touched on in the presentation, but do you think healthcare providers, nephrology, frontline nursing, social workers, pharmacists, dietitians, are healthcare providers given the training and the tools they need to support people, not to solve the problems we're talking about today, but at least point people towards resources? Megan or Kara, I'd be curious to hear your thoughts.
Go for it, Megan, and I'll join
Sure,
you.
I can start. I'm not too far out from my training, and I can say without any malice or anything, at the time when I went through my training, it was not a focus. Certainly it played a role, and it was present when you would do an assessment or learning about the different issues. But I think the focus at the training level is getting that solid medical foundational knowledge down. And unfortunately, back then, that wasn't really part of the core competencies. Now, that being said, I'm several years out from my training, and I do see a shift. And I can only speak to the medical training, and perhaps Kara or some of the other nurses on the call can speak to that perspective. But at least in the medical training, I have seen a shift in the way that we approach patients, the way that we assess patients, even the way that we talk about patients, or how we refer to people living with kidney disease as more than just a patient, as someone who is living with a condition. So I see the tides turning and changes are happening, but we all know that changes are slow. And I do think that this next generation of providers is going to focus or have this issue of wellness and holistic care. It is going to play a central role, I think, in care going forward across disciplines, not just in the kidney world, but I think more and more new grads, new trainees who are starting are going to be shifting their focus a bit. I don't know, Kara, can you speak, or one of the other health professionals speak to their experiences?
Yeah, I'll just start, and if Andre or Stefan or anybody else wants to join in. I mean, and I said in my story, like I had a year rotation through mental health. So was I prepared? Yes, as a nurse. And I would say that many allied health, we are trained in approaching a person as a totality of parts, that you are more than the sum of your parts. You are more than your kidney and your heart and your brain and, you know, all these things. And yet our system many times doesn't support that. It's incredibly hierarchical, and we come in and we're siloed. Now you're in kidney care, you know? And so our system in many ways hasn't caught up. And I would say it still hasn't, but we are the change. We are going to change it and say, no, we have to take a different perspective, as was said earlier, from disease-centered to person-centeredness. So and this forum is a huge part of that, to say, this is a really important issue. So can we learn more? Yes. Are we doing it? Yeah, we're here today talking about it. So kudos to the Kidney Foundation.
Kudos to you for stepping up to talk about it. Andre, Stefan, I'm curious. Someone in the Q&A asked, how can we advocate for mental health resources for staff to check in with patients in the dialysis unit? I don't think I need to convince you of the value of it. What are the ways to move this forward? I bet you're a resource for your peers where you deliver care, like Stefan, Andre, you're probably, this patient's going through something. I'd be surprised if they didn't lean on you. What are your thoughts?
I'll just share something very as a nurse, I'm currently undertaking my nurse practitioner degree, and I'm almost there. I have 2 more rotations, but there is a huge emphasis now on mental health and what it looks like. I myself feel now very comfortable saying, you know what, and I'll share this with you guys. Like, I remember a year ago, I called in sick to work, and they transferred me to occupational health, and they're like, oh, so what's going on? And I said, I need a day for myself. I need to stay home and, you know, just a mental day for myself and to regroup and sort of like, because there was a lot going on at that time with the pandemic and so on. And so I think, had I not gone through the studies that I'm going through and the experiences that I'm living now, 5 years ago, I wouldn't have felt comfortable saying I need a break for myself. And so I think the new generations of providers, I think we are better equipped. Now, having a nursing background, and I didn't understand this when I went through nursing school, the whole holistic body, mind, spirit. But now I understand it very well. And like I said before, right? When I'm with a patient, it's much, much more different, right? I know every day when I'm coming to work, our shift usually starts at 6:30 a.m. And sometimes I think to myself, wow, this is really, really hard for me to wake up. It's snowing outside. And then I think to myself, what about my patients? They're also doing this journey. They're also making it into a hospital. And they're the patients. They're the ones who are going to be connected to the machine. They're the ones undergoing the treatment. So I just think of that, and it encourages me to sort of like pull it through, get to work with the best attitude, and again, understanding the patient's experience. I also know that a lot of mental health or depressive symptoms and anxiety translate into physiological symptoms as well. So sometimes, decreased appetite, abdominal pain, all of that sort of thing. So I tend to ask patients like, are you okay? And like I said before, when you talk to your nurse, we're a little bit of a bridge. We can always bridge what you're feeling, your emotions, and relate it to the doctors, because doctors are always not around, or other healthcare providers. So be open with your nurses, because they could be a great resource for you as a patient.
Well said. Stefan, anything to add?
I would just have to agree with Andre, just being open and clear with kind of what's going on. And again, with the mental health aspect, your emotional state will also play a part in your physical state, right? So if you always feel crummy emotionally, you may also feel crummy kind of physically as well, and they kind of go hand in hand. A lot of people don't think about that when they're going in for, you know, an appointment or their dialysis, but it is an important part of, again, the holistic picture.
Right. Loretta, you have I'm just going to get to a couple of questions in the Q&A in a sec, but Loretta, very briefly, you were a nurse who became a kidney patient. Maybe that gave you some insight, like you understood what it was like on the other side of the chair. It's hard to find the time to negotiate that, but I think you probably learned, you mentioned about self-advocating and having the courage to speak up. In your role as a registered nurse, would those sort of questions intimidate you, or would that be an invitation to bring forward more resources?
No, I was actually a nurse that would actually push and probe when I felt a patient was uneasy, frustrated, any of those negative type emotions. I would just draw my chair up and look at them eyeball to eyeball, and I say, what is really going on here? You know, we don't have to talk about your diabetes today. What's going on with you? Like, how can we help? You seem down, you seem frustrated, whatever. And I would say the biggest thing for me being a registered nurse was when I was acutely ill with kidney disease. I had a acute kidney injury before I got into chronic, but just the experience of being so full of fluid that you can't even complete a sentence, having your feet and legs so swollen that it's painful to walk, painful to stand, all those things. Experiencing that and then going back into nursing and looking at patients and hearing their stories, it was so much more just clicked. And you just, yeah, I appreciate that you're short of breath. I appreciate the swelling in your legs is a barrier. You know, all those things that you don't really appreciate. You can study about them, know all you want about them, but you don't appreciate what the human cost is. Yeah, that's the big message, I think.
Well said. I'm just looking through the questions and answers. Carol asked, how many kidney patients truly reached out for mental health support? How did you go about it? I think this is the start of the conversation. I hope people have learned a little bit about how to open that up and find, you know, a care provider that's going to be open to that. I can't say we've solved that problem. Someone said there's so many questions. How do we stay connected after? This is the start of the dialogue. Join the peer support session at the end of the day tomorrow. Look at your Kidney Foundation website for information on how to stay connected to amazing volunteers like you have here. Yeah, I wish we had more time, but I'm so looking forward to this last part of the session. Our friend Brenda Brown, we have some time now at the end for her to bring us back in a very brief exercise to find some calm, some peace, some inner stillness to sort of close out this session and really get us back focused on being here and in the moment. This is the first session in what looks to be a long day. Brenda, I'm going to hand it over to you to guide us through a brief exercise, please.
Okay, thank you. If everybody wants to just come forward a little bit on your chair, if you could for me, please, just so you're not leaning back against your chairs. That would be very helpful. Just so I want you to sit up straight in your chair and roll your shoulders back and away from your ears. And then we're just going to tilt our head so your ears go to your right, just for a nice little stretch in your side of your neck. And then we'll come to the center. And go to the left, and then come to the center. And then I want you to take awareness of where your breath is right now. You can do all of this with your eyes closed. Just, you don't have to look at me. You should be able to follow my voice. Just find out where your breath is. A lot of us tend to breathe throughout the day in our upper chest. And I'd really like you just to notice where it is. And then breathe a little bit deeper. Try and see if you can breathe all the way down into your belly. And then sigh it all out. Get rid of all that stale air. And then do that again. And sigh it all the way out. And then one more time. I'm going to teach you a little bit of a beginner's breathing exercise. It's called pranayama, which means life force or what flows. Breathing in and out of our nose essentially engages our parasympathetic nervous system, and it sort of brings a sense of calm. And you can do this any time of day when you're feeling a little bit anxious or nervous. Do it before a presentation, do it at the end of your day before you want to get some rest. Any time of day, it can take just a few moments to do. And it's a really good beginner's breathing practice. And it's really something you can extend over time. And it's just something I'm going to teach you how to do here quite readily. It's called samavriti, which means even breathing, or another way to term it is four-square breathing. So essentially what I'm going to get you to do is to inhale to the count of 4, hold to 4, exhale to 4, hold to 4. And I'll lead you through it. I'll count you through it. If 4 is too long for you, it's something you can work up to, and you can extend to 6 or 8, whatever the case may be as you get better at it. Do it to the count of 3. But I'm going to lead everybody through the count of 4. You'll have to do what makes it feel good for you. So we're going to do this through our nose and exhale through our nose. So inhale to 4. Now inhale 1, 2, 3, 4. Hold 3, 2, 1. Exhale 4, 3, 2, 1. Hold 3, 2, 1. Inhale 3, 2, 1. Exhale 3, 2, 1. Inhale 3, 2, 1. Hold 3, 2, 1. Exhale 3, 2, 1. And you can do that up to about 10 times, anytime that you need to have a little bit of just catching your breath, grounding you into some sense of calm. And again, you can add a mantra to it if you like. It's just a way to bring the sense of calm into your nervous system. And it's an easy, like I said, beginner's breathing exercise. So just to close this off before you go into your break, I'd like you to again, sit tall, raise your arms high above your head, and then lean to the left. Get a nice lateral movement into your side body, long into your side body. Inhale into your right lungs. Come straight up. Inhale, reach towards the sky. Lean to the right. Again, feeling that stretch into your left side body, all the way into your ribs. Breathe into the left side of your lungs. Inhale to center. Bring your arms down. Now hold on to the left side of your chair and just twist to the left. Looking towards over your left shoulder if you can, as far as it's comfortable for you. Inhale to unwind, back to center. Bring your left arm over to the right. Twist over to the right. Twists are really good for our internal organs. You sort of like twist them, wind them up, bring them out. And then bring it to center. Thank you.
Thank you, Brenda. What a way to end this session. My thanks to Lisa, Stefan, Andre, Loretta, Megan, Kara, Wade, Nadia. What a wonderful discussion. Thank you for being open and honest and so supportive of others. For further information, please reach out to your regional Kidney Foundation branch. You can find it at kidney.ca or email kidneyprograms@kidney.ca. The Kidney Foundation is committed to connecting patients and families with the information and the resources they need. And we invite you to connect with us and speak with someone in your community to get further information We now invite you to find your way back to the lobby. You'll be rejoining the next session with the same ticket with which you joined. I just want to give a plug too. Brenda's doing a session tomorrow on movement at about 3:45 Eastern Standard Time. This was a teaser. You get the first bit free. You got to commit 45 minutes tomorrow to learn how it all ends up. Thank you for taking part, and I hope this is the start of a wonderful forum experience for you.